Dumelang and welcome to Mummy Diaries. This show is about motherhood, parenting, and this amazing journey ya hudisa bana ba rona. On today's show, she's back again, Dr. Bongi. She's going to be our favorite doctor.
Oh.
Yeah, you must just keep on coming back.
And back and again and again.
How are you?
I'm fine, thank you. Thank you for having me back.
Yes.
This was so fun.
Yeah.
The first time we did it.
Yeah.
And I'm happy to be here again.
Yeah. And for those who didn't watch our other episode, who is Dr. Bongi?
So Dr. Bongi is an obstetrician gynecologist. I work both in public and in the private sector. I own my own private practice at Park Lane in Parktown. And I also work at Chris Hani Baragwanath Hospital. I head my own unit there, and I work with a lot of, women. You know, I've been in the game for a while now.
Yeah.
You know, I've been a doctor for more than 10 years, and I enjoy what I do.
Yeah.
I really love what I do, and I think I wouldn't do anything else. Yeah.
And where do you get the time? Because if you have your own practice, you work at the public hospital, you work at the private hospital. So every day you're at work.
Every day I'm at work. You have to find a way to structure yourself. Okay. It's difficult. I mean, balance is very hard because I'm also a mom. I'm a wife.
Yeah.
Everything else that we tick into our boxes.
Yeah.
But you make space and you make time. You find pockets. Like I tell myself I don't work on Sundays because that's for my kids.
Yeah.
That's for my kids. That's for my family. But all the other days I grind. I try to take leave. My husband will be like, no, you don't. But I try to take leave, and I try and figure out what's important.
Yeah.
You know.
Yeah.
But it is difficult.
Yeah.
I mean, being able to juggle everything, sometimes some things lack more than others, but we try. You know, I do work full time.
Yeah.
I do my private work, which I quite enjoy. I also enjoy working at Barra. I do a lot of teaching, so I feel like that's why I need to stay, you know, and do the teaching, make sure we're cultivating the next specialists that are coming up.
Yeah. Between school drop-offs and chasing life goals, saving often feels like something we'll get to eventually. But what if it could just happen almost automatically? With Absa's Savings Coach, their latest innovative and fun way to save, it can. You choose your goal. Maybe it's a family holiday, school uniforms, or even just an emergency stash. And the app helps you to save towards it. You can even set it to move money every payday or even when you hit a certain milestone. No spreadsheets, no fuss. It's all inside the Absa banking app. So make saving one less thing to worry about. Start today with Absa's Savings Coach. Absa is an authorized FSP and registered credit provider. T's and C's apply. Most of our topics are always based around little babies, like babies.
Yeah.
And sometimes I've realized, like, I get comments where we have mothers who are mothers to teenagers.
Yes.
And, you know, that is a hectic... I'm not there yet, but it's a hectic...
Yeah.
I can only imagine because I was a teenager before and I'm sure
How
I put
it
my
is,
mom through hell. So I want us to talk about the reproductive health.
Yeah.
But when it comes to teenagers.
Yeah.
So first of all, when I was a teenager, I didn't go to a gynecologist. Gynecologists, they're already sexually active or they are older.
Yeah.
Yeah, let's talk about the reproductive system, teenagers, especially when they are on their adolescent
stages. Yeah. So I think what's important for us to know is that introducing our kids to gynecologists at an earlier age, you know, or it helps in their health-seeking behavior. If your daughter knows that if she's got a problem related to her reproductive system, if you've introduced her or she knows that you go to a gynecologist or a doctor, then she knows that's where she can go. We find so many people or so many ladies who delay seeking help because they don't know. One of the other most important things, because I run an endocrine clinic at Chris Hani Baragwanath Hospital, also like it's together with infertility clinic, and so then we find you'll have like a 23-year-old who's never had a period before, only coming for the first time at the age of 23. And you're like, if you had come a little bit earlier, then we can be able to find out what is the problem. Can we fix it? We have people who've never even gone into puberty, who come such a later stage. And that's all due to lack of education and lack of knowing, because someone will sit there and be like, okay, my period is probably going to come. And then you don't know when the actual milestones are, because if you've got a 13-year-old who doesn't have any secondary sexual characteristics, they should probably be going to a gynecologist or a doctor to find out why is it like that. Or you've got a 15-year-old who hasn't started menstruating yet, or a 16-year-old hasn't started menstruating yet. Sometimes people can have a little bit of a delayed puberty, or a bit of a delayed going into their menses, but you shouldn't leave it too long, okay? And similarly for boys, for boys, people who haven't developed properly in terms of their testicular growth, enlargement, also maybe a pubic hair or anything like that, and they're reaching the age of like 14, 15, they should be seeking help, But now, remember, we as the parents are not as well educated. Therefore, we don't take that onto our kids, and then we don't know. And that's why also the importance of the conversation between the mom or the parent and the child is important, because you'll be able to pick up things like that and then be able to usher your child to seek help for things like that. So I think that's the most important thing also. I think the other important thing that we also need to talk about is the fact that people say, oh, you've got a period, it's painful, deal with it.
Yeah.
We shouldn't be suffering. We shouldn't have our kids suffer with painful periods. I remember the number of times I skipped school because of period pains, heavy periods, messing yourself at night, or, having to wear extra large pads during the day when you're going to school, always standing up worried, did I mess myself or that you take your child to the gynecologist, Let them see, Iguti, is there something that they can be able to be helped with?
So let's just track back to what you said about delayed periods or puberty.
Yeah.
So if someone goes on their period by like 20-something, is that there's something wrong? Or it's just, cause sometimes, people will be like, they go earlier, woman 9 years. Is there something wrong with that? And if you are late, is there also something wrong with that?
So if you're late, there possibly is something wrong. Okay.
What is late?
Late, as I said. So if you're 13 with no secondary sexual characteristics, meaning the hair growth, the breasts, the pubic hair, and all of those, all right? Once you're hitting about 13, 14, because you should have mounted a puberty response by then. Because menstruation is actually the last part of puberty. You've got a whole lot of other things that happen prior to you menstruating, okay? So if then you haven't mounted any sort of response, then you seek help, okay? So if you've mounted a response but nothing is actually coming out, you should seek a response. Sometimes there might be something that you see that could explain why there is. Sometimes it might not be a problem and you're just a little bit delayed. But getting to the ages of 23, 24 without a period, then there definitely is something that you need to look into.
And why are our kids now, like when I say now in our generation, our kids, why do they go on their periods earlier than us?
It's been looked at quite a bit, and they've been looking at environmental issues, our diet, like basically just exposure, because you can have a child as early as 10, sometimes 9, going into the periods, which is why the conversation also about reproductive health and menstrual health and hygiene is so important for us to be able to have with our kids. You can't delay it for a later stage. You can't defer it for somebody else to do it. If you're a parent, sit down and talk to your children.
So there's nothing wrong with our kids now. It's just the things that we eat and our diet. And
so I mean, there's a whole lot of hypotheses related to why our kids go into puberty early, but it's a whole lot of environmental, diet, and everything else that happens.
And as parents, when is the best time to start having these conversations with our kids?
I was actually having a debate with my husband about this. And we were laughing, we were saying, and when we're looking around research related to that, they actually say from about the age of seven to about 9, we should be having conversations. And I see your face. You're just like, oh my God. My husband did the same thing. But remember, you're not going to. But remember, you're not going to be talking about sex at the age of 7 or 8.
Yeah.
You gauge where your child is at that stage. But it's important for you to, you're bathing. You're bathing your child. You talk about their body parts. You can do a lot at that time. And there's also a school of thought that says use appropriate language, use the actual language. Call, if it's a vagina, call the vagina. Yeah. So there's also that. And so they say, so at that stage, obviously you're going to be talking about sex and all of that, but you're going to be talking about body. There's so much affirmation and good body image that you can bring into your child. There's so much that you can find out about what they know. Because remember, kids are very explorative, Kids touch, the number of times I've had to take out like little beads or like small little foreign object from a girl's little vagina, because now they're exploring the body. And it's not even sexual. Yeah. It's the fact that they're just exploring themselves. And for starting the conversation that early, and for them to know what is my private parts. And also, you can also gauge from there, how the conversation goes in terms, you can also be protective against abuse, because, there's a lot of abuse. There's a lot of people who groom your kids, sexually groom your kids and all of those. So when you have those conversations, you can then listen to what the language is that they use. And there's a lot that you can pick up. And then as the stages and as they grow, then you can change, and be able to talk to them about whatever they can, take at that stage. So once they get slightly older, then you can introduce a little bit more heavier topics. Yes. But they say we must start like quite early. And the other thing that I thought was quite important was because I have a 6-year-old.
Okay.
Well, she's 5. She says, Mom, I'm 6. I'm like, no, you're still 5. She's turning 6 in December. So I have my 5-year-old she's like a mini 13-year-old, she's very assertive. She's there. She's, and I've got a 14-year-old nephew. Okay. And I remember when I started talking to my kids about their bodies, like my son, I'm allowed to say penis.
Yes.
So when I was watching my son, so he asked me, but Mom, I was like, no, this is your penis. Yes. And obviously because he was a bit younger, he called it his peanuts. Yes. And then, so now when the kids are bathing and stuff, then he's like, oh, my peanuts. Then I realized that my daughter started calling her private part peanuts.
Got you. Because
her brother. Yes. And then my 14-year-old was like, nope, this is your flower. So now she comes back and she's like, I'm like bathing and she's like, no, this is my flower. Yeah. I'm like, how? She's like, no, so-and-so said that this is my flower, therefore this is it. And that's because my sister, when she speaks to her kids, she's very expressive. She talks to them and she gives those, affirmations. So then it was easier then for me to pick up the conversation from there. Because, as much as I'm a doctor and everyone will be like, oh, but you deal with the stuff all the time, it's still scary.
It is.
How do you talk to your kids, about those things? It's scary. But you have to man up and do it. Because the alternative to that is that somebody would have spoken to her in a different type of way. And now we're not dealing with a flower, we're dealing with something completely different. And now you've got your little girl who's exposed to unsafe, conversations, and where else are you going to pick that up if you don't have a conversation with her?
Yeah. So now we spoke about girls. Now let's talk about boys. I get girls go to gynecologists.
Yes.
Where do boys go? Because I always see how sometimes I sideline boys because I don't have a boy.
Yeah.
But when you have friends who have boys, you hear different things about, like you're saying about their penises and, the growth. And I didn't know how you should also, not measure, but check how, if it's growing, or not.
They've got hair, they've got all of those. Yeah.
So when we go to gynecologists or when we take our girls to gynecologists, where do we take our boys?
So the first line would obviously be a general practitioner, both for the girls and the boys.
Okay.
And then depending on what then you see from there, the boys can then go to a urologist.
Urologist.
Yes.
Okay.
And then girls would then come to a gynecologist.
Okay.
Yeah.
And what are some of the common problems that boys boys have when it comes to their reproductive? They have a I want a reproductive one.
So we call everything reproductive.
When it comes to their reproductive.
Because I mean, for them it's
system.
a penis and scrotum
Yes.
and all of that.
Yeah.
So I mean, there can be a whole lot of other problems that they can come with. So the testes might not descend. Okay. Because remember, from embryology, they start from the top and they go all the way down. So they might not have properly descended testes. They might have things like priapism if they've got the foreskin that traps, and like a whole lot of other things. So if their puberty is delayed as well, or they have puberty comes too early. So they do have, similarly to what girls can have as well. Yeah.
And now the sensitive topics, obviously we're talking about teenagers, reproductive health. Now we have to think about contraceptives.
Yeah.
Talking about sex, because we know that the conversations that we had with our parents, as soon as your parent our nadi period, it means that you're gonna have a child.
Yeah.
So this means that that's the only conversation I had. Stay away from boys. Utluwa pregnant. What you were talking about I should not have period pains. I didn't know. I thought it comes with.
We all lived with it because everyone tells you, "Goody, oh, I've got period pains. Oh, don't worry, we all had."
Yeah.
Oh, I've got period. Oh, don't worry, we always had. And sometimes what we find is that there's a whole lot of things that can be wrong in the adolescent stages. Kids can have endometriosis. Okay. Yes, they can. You can have adolescents who have endometriosis. And sometimes it's not just, painful period. It might be that. But the difficult conversation is then when you have to sit a mom down and say, I have to put your child on contraceptive or birth control to be able to control their pain and their bleeding. Woo!
Hey, contraceptives means that it goes
the conversations
somewhere.
I've had over and over with moms. As a result, sometimes my little girls will come in because maybe I've seen them once and seen them twice. The first consultation is obviously always with mom. And then when they come back, and then I'm like, bring your mom in, because I'm not going to start this without having conversation with your mom, because I know exactly what your mom says because of what my history looks like. Then I sit mom down. I'm like, listen, this is what we're doing. And you find that the moms who bring their girls in, already have started having conversations with their children, and they're already in a safe space. And so they not the going out, having sex, not listening, or all of that other stuff. Yeah. They're already in that, And then the mom then is worried like, but my girl is like this. She's so pure. She's innocent. Now you can introduce this thing. But I always have the conversation of, think of it as medication. Okay? If you've got a headache, what do? You take a Panado, isn't it?
Maybe we shouldn't tell them probably they are contraceptives. Maybe it's medication that will manage their pain.
No, but that's consent, because they also need to be part of the management, because at a later stage, that's a conversation.
Yeah, I understand what you mean, but I also understand where the mom is coming from, because that conversation is quite. Yeah. Because we used to think, when I used to. There used to be this thing called collocationing, where when a girl goes to clinic, for injections. And it used to match, not in a bad way. You would see the massage only takes a drive. So it means that if your parent allows you to go take contraceptives, then only a teenager, it means that they're saying, we didn't even think of maybe the other things that do
help in terms of the medication.
There's nothing else that can help.
I mean, there is a whole lot of stuff that you can try. I mean, pain medication, different things. But ultimately, if you're dealing with somebody who's got severe periods, heavy pain, in the endometriosis realm of things, then we do have to use something hormonal to be able to control that. Yeah. And unfortunately, that's birth control, And I wish, in my heart, the stigma related to it can go away, so that more girls can be able to can receive the help that they need, like what you say about if a child seeks, goes to the clinic to go get contraception, then immediately she's loose, she's there, she's sleeping with everybody. Therefore, we're just doing this to prevent them. But I think that's done is that it has isolated our little girls and is completely taking them to somebody who wants to do good, who wants to, do good healthcare seeking behavior. They don't have anywhere to go. They're always judged. They're always shamed. I mean, when I work in clinic, like in an antenatal clinic, and you have a 14-year-old who's pregnant or a 15-year-old who's pregnant, the conversation is always the same. They'll always tell you, no, I'm not on contraception. And you're like, why? It's like, I don't know what to use. And you would think that in this day and age where there's so much information out there that people would be able to know, but they don't, because no one guides them. Because if you're 14, what are you doing with contraception? We are privileged because we're growing up in a society where we're protected by our parents, and therefore we protect our little girls, There's a whole host of little girls who are running out there with children-run households who have nowhere to go, who don't have older sisters or older parents or anybody who can guide them. And the one way they can protect themselves, because no one has told them how to protect themselves. So they go to the clinic because now they know Kuti, there's Utemba, who is my boyfriend, who provides whatever he does, and therefore I can't fall pregnant now because of whatever. And so when they're going to be able to get protection, they can't. And then you have the 14, 15, 16-year-old who comes in and then they're pregnant. I mean, obviously there's the alternative of everything else, but I wish the conversation can be a little bit more protective, and the contrary of it is that there's so much sex out there. You switch on a TV and you see sex. You look on your phone, there's sex. I think PG-13 for when we were kids is not PG-13 for now. No. But we still have that mentality of back then. So where do we expect our girls to go? We give them sex, we feed them sex, we give them devices. They look at it. We have friends who teach them. You have older voices who talk about it. And then we say, oh, but you want contraception. How can you? And they go to the clinic, they want to go, how could you? Yeah. So that is my wish. I wish we could have better conversations when it comes to that. Find better ways into protecting our little girls, Take away the stigma, take away the shame, don't get me wrong, I'm not condoning kids having sex.
Got you. But they are.
Kids are having sex. Sure. Evident by our statistics of teenage pregnancy in South Africa. Yeah. Evident by what I see in antenatal clinics. Evident by what I see in our gynae wards. Yeah. Kids are having sex. Yeah. Whether they're having sex with their own peers or the same age as them, older people, they're having sex. And so I think we cannot shy away from that conversation at all.
Yeah. And I think for me, the conversations I've heard, because like I said, there's this thing, man, and I'm not saying this in a bad way. Yeah. There's a difference between manese, I go public hospital, le manese, I go private hospital. And I'll make an example. It should be a safe space for Lerato to go to the clinic and say, I would like to start contraceptives. It should be a safe space, because it's she knows better. But ona manese, woo! Like already, I've heard kids go clinic because of how manese treat them. What can we do with that, doctor? Because it really happens where, especially where manese are who end up judging the kids because they are there to find or seek help. You know what I mean? I don't know if this is new to your ears or not, but it happens a lot.
Contraceptive. Yeah. I think we need better education. Yeah. And I think we need I think how healthcare would work is if we take away our prejudice and our judgmental state when we deal. So when I walk in here or when I walk into my private practice, I'm like, yo, my abasi, hey. It can't be like that because that is what creates the judgment. So, I mean, the conversation of overworked and little pay and little resources and frustrations and all of those in our healthcare professional is a reality. I mean, you can't take that away because it does play a certain role, but it's not excusable at the same time. We should be creating safe spaces.
Yes.
And if somebody has strong enough to, let me seek help, we shouldn't then add secondary victimization. So I think education and training and sensitivity and mental health related training and that needs to be more incorporated in the things that healthcare professionals do. Because
because it's not nice.
No, it's not. I mean, I've heard lots of people who complain about such, and as a result, people say, "Oh, I missed my injection once, and I'm not going back." And it's
not nice. And then as parents, what are the signs that we should look out for? If, like, let's say, for example, your child has problems with their reproductive system.
So as I said, very painful and heavy periods. Don't ignore that. Help your child seek help. Okay. And odor, odor in terms of their private parts. Girls sometimes might have like a bit of a discharge. Maybe they've already started having sex or not, or relate, but you need to be able to address that. Also, like emotionally, I think kids withdraw a lot because they have their self-esteem changes. They become, they regress, and mood changes like that, especially in your girls, is very important. And then they say that alternatively for boys, they can become a bit aggressive. So for you seeing a child, they generally like this, and all of a sudden become aggressive. They don't want to do the things that they wanted to do before. You should look into that. And that's why as parents, the relationships that we have with our kids is very important, because once all those changes start happening, it's going to be easy for you to be able to pick up. And then once you pick up something like that, don't ignore it. Because sometimes it's a cry for help. When they become aggressive, it's a cry for help. So then step in as a parent, and try and do something about it. Even if it's not you who does it, send them to a place where they can get help, Yeah.
And then the aggressiveness for boys in the hormones.
It can be hormones, but I mean, if somebody is touching your boy inappropriately, or somebody is doing something inappropriately to your kids, or once they start going into puberty, they will have some of those changes. So so it can be from the hormones, because you've got a surge of hormones once you go into puberty. But it could be if something is wrong and they don't know how to express themselves, or they don't know how to talk to you about it, they can have different changes in terms of their mood, in terms of the way they conduct themselves. And so sit down and talk to your kids when something like that does happen.
And just like us who suffer from adult acne, obviously teenagers, that's the time where now the skin starts breaking out. Would you recommend that they must also be on contraceptives, like the advice that you give us, the older ones?
It
depends. To balance the hormones.
It really depends on, it would be an individual basis kind of thing. Okay. Not all acne needs to be treated with contraception. Okay. It will depend on what the problem is. And also then maybe not so much contraception, but maybe dermatology. To then know how to then work around that. But it's not a baseline that all kids then must go on hormones. No. I think it's an individual basis. It's to see exactly where they are, what help they need, and that comes with being able to assess somebody.
And kids spend most of their time go school, What can schools do to make sure that they also have these conversations with kids?
I mean, I think there is a curriculum. I was looking at like life orientation things and all of those life sciences or life orientation, where they do have introduction to all of these big reproductive topics, which some people always have like qualms about. Why are you teaching my child about sex? Oh my God.
Life orientation parents don't like it.
It's so funny because my helper was up in arms. She was like, oh my goodness. The homework that my child brought, Uti, I was running away to the room. I was like, oh my God. I'm like, but that's an opportunity for you to be able to speak to her. Because now you're doing homework with her and she's asking about A, B, C, D, E. Jump in. Don't run away. Yeah. That's the opportunity. Because remember, the schools are going to bring in all the factual things. They're going to tell you have a menstrual cycle. Yeah. This is how long it's going. They're going to tell you have an STI. This is how you get it. This is how you treat it. They're going to tell you what menstrual hygiene should look like. And all of those. And then you as a parent, you can come in, affirm that, change the conversation to all your cultural beliefs and all your religious beliefs and so you change the narrative of what that raw information looks like. You bring in the emotional support, you bring in the understanding, and you bring in what you want your child to understand about the information that they're having. Yeah. So now if you run away, all they're gonna have is facts. Right. You see. And so I think schools and parents would work so well together. And let's not run away, guys, from that conversation. Yeah. Let's not run away.
I think maybe it's also, I'm sure it's different from if your helper is older or if, like, let's say your kids have been raised by their grandmother. Yeah. Because grandparents do not have time to speak about these things.
No, they don't.
And sometimes because maybe you work far, your child or your children are with Gogo. Yeah. Then what do we say? Because I don't have conversations with my mom about sex. So I can only imagine if I had to leave Nema with my mom and go somewhere.
And then having to have those conversations with her later stage. It's like, oh my goodness.
Yeah.
Yeah.
So let's talk about culture and religion. Yeah. Like what are some of the challenges that when it comes to patients, let's say, you would hear stories about certain churches don't allow for women to take contraceptives. Yeah. Or, like culture and religion can affect
a lot. It affects a lot. I mean, just as a baseline in terms of religion, you talk about masturbation and you're just like, oh, what is that?
Masturbation, and that's what we hear. Yeah.
You talk about sex, oh my goodness, what is that? You talk about anything, contraception, as you said, some religions don't allow it. Yes. But we need to find a balance. And I don't know where that balance is going to come from because, I mean, I had a very religious mom as well, It was difficult for her to have those kind of conversations with us. Mama's like, when you... Yeah. Mvana. Yeah. Someone saw you. Yeah. That's all. Yeah. That's where it was. Yeah. And that's how but you can't do that these days. No. You can't be like, Siguzulu go to khuluma nomfana. Because now they have on their phone. Yeah. They're speaking to the boy on the phone. I know. So we need to find that balance on being able to expose our kids to all of this, but being sensitive to culture and being sensitive to our religion.
But it sounds like they can't coexist. Like
it's not that they can't coexist. We just need to be sensitive that, I don't know.
Yeah, especially like you're saying, even though body like masturbation, and even if it's a conversation about older people, where we spoke about masturbation and all that. How masturbate? You are calling satanism and what to come, and then the doctors are like, no, that's how you learn your body.
You learn your body,
and when you guys say it, it makes sense. So,
I know my body. Yeah,
so it means that if this is my body, I know my body. Let me explore my body. Yeah, pastor. Hey. After explore, Monday, Barry. Hey, and sometimes get back born a good way the night before. Yeah, and then it becomes things that we are even shy people do it in secret because not that obviously you don't go around masturbating in public, but I'm just saying, like, it's a conversation you can't even have in safe spaces anybody. Because culture and religion sometimes cannot coexist with getting biology or science.
And that, and the not sad part per se, but the repercussion of that is that we have adults who don't know their bodies, adults who have got problems with sexual anything. The number of people who walk in and be like, I've never had an orgasm. Because it's like, you've been told that if you want to have sex and you want all of those things, then it's like a taboo kind of thing,
Yeah, so, like it's like they hold back.
Yes, they hold back. Sex is painful. They don't know how to have conversations with their partners about it. And so those heavy conversations, those baseline heavy conversations, then equal to the adults who have sexual related issues later on in their lives, in their relationships, in their anyway, So I don't know how to mirror the two. I don't know how they can coexist.
And then, when you're talking about this, I think they can coexist because there's a thing called pitiki.
Okay.
Pitiki is a ceremony where women come together, older women with a younger woman. And they have these conversations.
Yes.
And they talk about sex. I've attended pitiki before. I wish every woman can attend it. But now you would hear those who know what we do go pitiki, Basotho ba rata banna. Because of pitiki. Go pitiki is like you learn. You learn that sex is not just about you satisfying your husband. You also must be happy and satisfied. But how about, hey guys, Basotho, that's why they so sex. And I'm like, they can coexist because it's quite cultural. It's not just a conversation where we're talking about they talk about everything that has to do with marriage, sex, and it's older women talking to younger women. So I think they can.
I think that is such a good basis of a cultural something that should be replicated across the board for everyone. We definitely need safe spaces for our little girls and boys. We definitely need safe spaces because the alternative of that is very scary. Because who's going to teach your child about sex if you don't? The person who wants to sleep with her.
Sure.
Regardless of their age, regardless of what their intention or anything is. That's where they're going to learn sex.
And then, doctor, if you are a parent to a teenager, like we're talking now, you find them by mistake masturbating, or you see something on their phones, what should you do? Because like you're saying now, it's not wrong, but like when you find your teenage boy masturbating, I'm sure it's traumatic. I don't know, but I'm sure it's traumatic.
It is traumatic.
Yeah, like what do you do? Is it the time for you to start having that conversation about masturbation, or you tell them, okay, stop, my boy, the right time will come?
No, that's any cue is a good cue.
Okay,
any cue. I mean, it's very traumatic if that situation happens. But you can't ignore it because it means that your child is now exposed to sex from wherever they're exposed to sex. I mean, young boys have erections all the time. They have wet dreams. They have all of these things, everything that happens to them. So if you don't talk to them, then it's a problem. I remember when I was, I have an older son. Okay. And we had I don't know if it was homework. I can't remember what the cue was. But then the conversation had to happen. Oh, my husband was like, oh my God, how are we going to even chat this, And I was just like, let's just do it. And then I said to him, you know what? The approach must just be medical. Let's sit down and let's just do the medical route. So we sat down and did the medical route. You speak about condoms, you speak about their bodies, you speak about the emotional connections, you speak about all of those things. But whatever cue, use it. Don't ignore it. Because then that's your way in. Whether it's homework, whether you find something, whether you see a condom, whether you see anything, it's a cue. Sit down and have a conversation. And sometimes people will be like, oh, how do I even start? There's lots of places where you can send your kids as well, maybe, If you can't initiate that conversation, take the child to a gynecologist or even whoever can have a conversation. Take your child to a healthcare provider. Take your child to a psychologist who talks about these things. Take your child to a safe space where they can be able to be introduced to these conversations in a safe environment or in a safe manner. Because not all of us can have that. Not all of us can say, my child, this is a condom. And you must use a condom because of A, B, C, D, E. Sure. Because as parents, you feel like now you're just pushing your child to have sex. But it's a conversation that must be had. And so looking for places that you can send your child to, taking your child to the doctor, and then saying to the doctor, Mna, just do it, break it. And if you need to make it medical, then go ahead and do that, I think that's what's important.
And any advice in terms of generally the doctors will say, here are the vitamins for ABC. Are there vitamins that teenagers should start taking for just being healthy when it comes to their reproductive system? I don't know if I'm making sense. As people in J, we take vitamins every day, whether vitamin C or vitamin D and whatnot. But just for Bana, besides the contraceptives, is there anything that they can start be introduced to at an early age for them to be fine when it comes to their reproductive system?
Not anything specifically.
Okay.
No, I mean, obviously, if there is a problem that needs to be treated, that problem is treated. Okay. If there's a deficiency in terms of minerals and everything else that needs to be treated, that will be treated. If your girl is losing too much blood from the heavy periods, and they become anemic, then they need to be on iron supplements. Then that's something that can be treated. But there's nothing specific. That they need to, go on or anything like that, because the natural process of puberty happens. Yeah.
And then for people like you're saying, people with single dads, there's single moms and there's also single dads, and some of them maybe cannot afford to take their kids to psychologists and whatnot. What advice would you give to people besides going to other people in terms of them trying to help their kids when it comes to their reproductive system? Because if a girl child is being raised by their dads, some dads are not comfortable having those conversations, but sometimes
it's necessary.
Especially when it comes from a parent.
I think you should educate yourself. You must take it upon yourself to say, my child is now 6, they are going into that. Let me educate myself. There's a few programs. I think I saw maybe 1 or 2 workshops that are done. You flip through Instagram, you'll see something. Educate yourself. Go to those. Find out how you are able to speak, to your kids. Google if you have. There's a lot of information out there that you can be able to consume. There's ChatGPT that you can type into. How do I speak to my 7-year-old child or whatever? And it might not tell you step by step on how to do it, but it'll give you an idea on how to then approach the conversation. And all you need to do is remove judgment, remove shaming, remove negative connotation. As difficult as that sounds, you just have to do it.
Sure.
And then you just...
the difficult part is removing the judgment.
It is.
Yeah, as a parent.
Yeah, it is.
Yeah.
So, also I have got nieces. I've got 2 older nieces. And sometimes my sister will be like, hey, it's your turn.
She can't do it.
It's like, it's your turn. Yeah. Also, you're a doctor, and also, hey, take it, And I've been privileged enough to be able to talk to them, to a certain extent. Yeah. So, which is quite nice then, because the conversations that my sister can't have, then I can have with them, But you have to have a community sometimes.
Yeah.
You have to have a community. I mean, single dads struggle through that, and I've heard people who even go as far as having like their closest friends who've got girl children. Who are females, who then say, you know what, our kids are similar, the same age, or your kids have already got into puberty. Please help me. I don't know what a pad looks like. I don't know what a tampon is. I don't know what is. Please help me. And for dads to know that they need to do that, it is such a beautiful thing, because you know you need to protect your little girl. And even if you can't do it yourself, if you can be able to find them the help that they need, which is a neighbor, which is a friend, which is, and somebody you trust, obviously, who's going to be able to portray the information the same way that you would want to portray it, I think that is a very good step for dads to take. Otherwise, educate yourself, learn, grind through it, breathe.
And lastly, what are some of the things that you might have heard from your patients? And like, when I say patients, I mean born, they're teenagers, that they're complaining about us, our parents.
About their parents.
The parents,
they complain that we don't listen. We don't listen to them. They complain that the judgmental part has come out so many times. It's like, but I was telling my mom that, and then she just, because most of the time we don't listen to understand. We listen to respond. What? Why is that? You know what I mean? But now they're trying to have a conversation about, and it might not even be them liking a boy to the extent of sexual interaction. It might be them trying to figure out their own emotions and their own feelings regarding why is this?
I feel this
way? Why, And we don't allow them that. So the judgmental part has come out so many times. The not listening part has come out so many times. And so then we isolate our girls and then they come to the clinic at 14 years or 15 or 16 years and they're pregnant. And then you say, but I didn't know. But I live with my mom, my dad, my 2 older sisters. But I didn't know. I think that sometimes that hurts me a little bit. It hurts me a little bit.
Because so much can happen under your nose because we don't listen.
Because we don't listen. And so the girls then find an alternative route. They find older friends, and then they tell them whatever they tell them. One girl told me that she was 15, I think. She was, I think her boyfriend was like 18 or 20 or something. And she says the boy said to her, "You won't fall pregnant." And she said to me, "I believed him, doc." I was like, but you've seen, but you know how babies are made. Didn't they tell you that if a girl sleeps with a boy, this happens, then you can make a baby? But he looked at me in the face and said, "You will not fall pregnant." And he's like, "No, man, let's do this thing." And they can't enforce condoms because of the dynamics in terms of relationship. They don't know anything related to, they don't have enough information related to how to then protect themselves in that situation. They don't know enough to say, okay, fine, maybe I should be using contraception. Nothing. And then the boy would tell them, "Don't worry, you won't fall pregnant. How's a man? And then they have sex, and then they fall pregnant. She's like, I'm shocked. I'm like, but don't you have friends who've fallen pregnant before? It's like, no, not really. But I've seen other girls from other schools fall pregnant, but I never thought it would happen to me because my boyfriend said I won't fall pregnant. And she's like, oh. If my older sister had a conversation with me, or my mom had a conversation with me and told you, Guti, don't go there because of A, B, C, D, E. And so that's what my little girls talk about. Those what the teenagers complain about. And then you say to them, okay, fine, so are you going to do contraception? They're like, what am I supposed to use? And you're just like, how can she be old enough to be having sex but too young to be able to know anything about contraception?
So everything is upside down.
Everything is upside down.
Like us knowing about sex before knowing about the important things, which is protecting yourself.
Yeah. And some girls lose their virginity before they even know what the virginity is and the importance of it and taking ownership of what it is.
Sure.
And then you're having a conversation and you just and you can see in Jaguti it doesn't match up. And I think I saw one older lady. She was like in her mid to late 30s. And she was relaying her story to me about how, like, the whole virginity thing. That's when it highlighted in my mind, and I started noticing it amongst my little girls. She's just like, I didn't even know. I didn't know that virginity was a thing that I could. Do you know what I mean? And she's like, I lost my virginity without even having pride related to it or anything related to it. She's like, so yeah, we need to speak to our kids. Man, we need to listen to our kids. We need to speak to our kids. We need to. We're not in the olden times where if you ignore something, it will go away, or if you just we're not there.
Our parents used to run from this conversation.
We're not there.
And then luckily, them running, they were lucky because of them running from it or being very strict about it, made us fear sex more than anything.
Yes.
Because now I used to think if a guy even humps on you, already, because my mom was just like, and like she used to lie to me and say, and all the what you did, and all the lies that were related. If your boobs are falling, it means that you're sexually active. Yeah. If you have cellulite, it means it's just
part and parcel of life.
But I was so fearful.
Yes. But nowadays, if it's completely different. Yeah. And if you say things like that, our kids are sensitive. Our kids are very... My daughter said to me, Mom, you hurt my feelings. Yeah. I was like, yo, mara when una 5, feelings is whooping is hetayo.
EQ thing that it teaches them about being in touch with their feelings. They know.
So now if you tell your girls that your boobs are falling, you've got cellulite, it's not going to do the same thing that it did to you, because I think we were slightly stronger. Yeah. We were. But they're sensitive. Yeah. You say that to them and...
You body shamed them. And
yeah. And now you are taking them in a completely new direction of depression, anxiety, body image issues, everything. And then they open Instagram because obviously you've bought your child a phone. Yeah. And so now they secretly have logged onto Instagram and TikTok and everything else. And then they look at those people and they're just like, actually a perfect person's supposed to look like this. If mina so, then ay.
Yo. And then lastly, I know I said lastly before. Social media has its own pros and cons. Especially TikTok. Because TikTok is like, it's video after video after somebody's sharing their experiences. Some is sharing. Now there's a new trend on TikTok where they are talking about how bad contraceptives are. I don't know if you've seen it.
I haven't seen it. I'm actually, funny enough, I'm not on TikTok. I'm trying to get into TikTok.
Yeah, just to
be able to see. I have a lot of my ladies will come in and be like, "Oh, I read on TikTok. I saw on TikTok."
So TikTok is bigger than Google.
Yeah.
Because now when you're looking for something, even if you're looking for a restaurant,
you just go and look. I've been told. So
you search and sometimes they do give good reviews and stuff like that.
Advice.
There's a new trend. I think my algorithm shows me stuff like that because of the type of content I always research on. Yeah. And bashing on if you've started contraceptives, they affect you. They do this. It's just negative things around contraceptives. Is it true, or it's just rumors, or it's per person?
So contraceptives generally, we experience them slightly differently. Okay. So, the adverse effects or the side effects of it is not going to be exactly the same for everybody. Yeah. Okay. So there is a personal element related to it.
Got you.
Okay. But I mean, it's not clean. It's a side. It's hormones.
Yeah.
Okay. Yeah. But I always say this to my ladies, who have that problem. Yeah. And I say to them, Guti, weigh your options. See what your benefit versus risk ratio. Okay. And also have an open mind. Okay. Because there is a lot of good that contraceptives can do in terms of treatment now outside the preventing of the pregnancy, the stuff that we treat and we use contraceptive and hormones to be able to treat in terms of your endometriosis, and all of those, adenomyosis. Sometimes you can give it for fibroids and all of those. Okay. So it's not clean. I mean, I'm a gynecologist and I prescribe contraceptives to my patients because of whatever that they need, But I think what we need to do is we need to have open minds. Like I always say to my ladies when they come in, oh, doc, I don't want this operation because I'm like, yeah, because unang antiwati una. I'm like, but remember, their experience is not the same as yours. Yeah. And the other part about social media is that everyone will discuss what is a factor for them. Because if my standpoint is the fact that I spoke to Pasi and Pasi angimthandi, because Pasi wins it 1, 2, 3, and 4, But someone else will come and have a conversation. Oh, Pasi is the best person in the world. It's perspective. And now the danger is that now person number 3 is going to hear what I'm saying about Pasi or whatever it is. And then that's it. And they take it. Yeah. So that's why person number 3 needs to have an open mind to say, okay, fine. This person number 1 and number 2 have a perspective. I'm an individual. I need to then make my own assessment related to this. And I might not experience Pasi or anyone else the same. Yeah. And that scenario must translate to your medical help, because not everyone, someone might have removed the uterus and it was the worst experience ever, but someone might remove the uterus and it's the best thing that's ever happened to them, And so being open-minded and being able to have your own experiences related to something and ask questions, Don't get them like, I'm funny. Why you ngaifuni? Which is what I normally do. Yeah. I'm like, okay, fine, no, don't worry. There's options. This is not the only place we're in, because our problem is this and we need to treat this problem. Okay. And therefore, when we treat this problem, we look at 1, 2, 3, 4, 5, 6, 7, 8 options. And whatever is tailor-made and is best for you, that's what we're going to go for. So give me a chance to have that conversation with you instead of being blocked off. That's that. Yeah. I think in terms of it can translate across life, but I think in terms of your medical health, that's very important because not everyone, we've spoken about public health care and everything. Not everyone is as patient. You'll come, they're like, I don't want this operation. Okay, sharp, next. Bye-bye.
Yeah, no one will have that time to say, listen.
Like, you don't want, okay, sharp, bye-bye, thanks. We'll see you in 5 years. Yeah. You come back in 5 years, please can I have the operation? Like, so you want it now. Yeah. So open mind. Yeah. An open mind, understanding, and, I think that goes a long way.
So what I took out from this conversation is, as parents, we must listen to our kids.
We must.
When they talk to us or when they want to talk to us.
100%.
Do our research.
100%.
Lorna, we must listen to you guys when you give us advice. I'm saying us as parents.
Yes.
Try to open our minds to different options and possibilities to help our kids. Lastly, closing.
Lastly, always be a safe space for your child.
Okay.
Don't allow somebody else to be a safe space for your child because you gave birth to them. Yes, you have your sisters, you have everyone, but if your child is in trouble, they must know that they can come to you. Yeah. Your child cannot be in trouble and they would rather die in the trouble than speak to you about it. Anything else we can speak about later. Yeah. But the safety of your child lies over there. That's where it lies. Yeah. So being a safe space for your child is the most important and the most biggest and the most beautiful gift that you can give your babies.
I agree with you. I hope I'll be Nema's safe space Batong.
Batong.
She must call me first.
Like,
I think that dad is the safer space than me. But I think also it depends on, like you're saying, some kids would be like, I'd rather speak to mom before dad or vice versa.
Yeah. But as parents,
parents,
no, you can't.
Yeah.
Your child can't be out somewhere and something horrible is happening to them. They're like,
yes,
Uzo. They must call you and be like, Mom, and then you are there.
Yeah.
And then have the conversation later.
Yeah.
So be a safe space for your kids.
Thank you so much, Doctor.
This was lovely.
I know. Thank you so much for watching.